D Group's, an established entity since 1999, has solidified its presence in the South Asian region, in Andhra Pradesh, with Hyderabad as its capital. And Pan-India Service. We specialize in occupational health center, OHC, services, comprehensive sales, and service of medical equipment, as well as offering cutting-edge lessing services.
An electrocardiogram, ECG or EKG, is a medical test that records the electrical activity of the heart over a period of time. The electrical impulses generated by the heart during each heartbeat are detected by electrodes placed on the skin, and the resulting data is used to analyze the heart's rhythm and function. The ECG is a valuable tool in diagnosing various heart conditions and abnormalities. Invention and history. The electrocardiogram was invented by Willem Einthoven, a Dutch physiologist, in the early 20th century. Einthoven's work earned him the Nobel Prize in Physiology or Medicine in 1924. The first electrocardiogram device, known as the string galvanometer, was developed in 1901. Types of electrocardiogram. Resting ECG. This is the most common type, recorded while the patient is at rest. Stress ECG or exercise ECG, ECG stress test, recorded during physical activity or induced stress. Holter monitor, a portable device for continuous ECG monitoring over 24 to 48. Ambulatory ECG monitoring, longer-term monitoring using a portable device for several days or weeks. Exposure levels. ECG is a non-invasive and safe procedure with minimal exposure to electrical impulses. The electrodes on the skin pick up the body's natural electrical signals, and the equipment used in modern ECGs is designed to ensure patient safety. Use and advantages. Diagnosis of heart conditions. ECG is crucial in identifying various heart conditions like arrhythmias, heart attacks, and conduction abnormalities. Monitoring treatment. It helps in monitoring the effectiveness of cardiac medications and treatments. Risk assessment. ECG is used to assess the risk of heart-related events in certain populations. Disadvantages and precautions. False positives. ECG results may sometimes show abnormalities that are not clinically significant. False negatives. In some cases, important heart conditions may not be detected by ECG alone. Interference. External factors like muscle movement or electrical interference can affect the accuracy of the results. Cost and manufacturers. The cost of an ECG can vary depending on the location, healthcare provider, and type of facility. In many cases, it is a relatively affordable diagnostic test. Several manufacturers produce ECG machines and related equipment. Some well-known manufacturers include GE Healthcare, Philips Healthcare, Siemens Healthineers, and Welch-Allyn. It's essential to note that advancements in technology and healthcare practices may lead to changes in the information provided here, so it's advisable to consult current sources for the latest updates. The electrocardiogram, ECG, machine serves the primary function of recording the electrical activity of the heart. The machine detects and amplifies the electrical signals generated by the heart during each heartbeat, producing a graphical representation known as an ECG or EKG. Here's an overview of the ECG machine's functions. Signal acquisition. Electrodes are placed on specific locations on the skin, typically on the chest, arms, and legs. These electrodes pick up the electrical impulses generated by the heart. Amplification. The weak electrical signals detected by the electrodes are amplified by the ECG machine to produce a readable and interpretable signal. Signal processing. The machine processes the amplified signals to filter out noise and interference, ensuring that the recorded ECG is a clear representation of the heart's electrical activity. Signal display. The processed signals are then displayed on a monitor or printed on paper as a series of waveforms. These have lead configuration. ECG machines can record the electrical activity from different perspectives, known as leads. The most common lead configuration is the 12-lead ECG, which provides a comprehensive view of the heart's electrical activity. Heart rate measurement. The machine calculates and displays the heart rate based on the intervals between the different components of the ECG waveforms, such as the RR interval. Interpretation. Modern ECG machines often include automated interpretation algorithms that analyze the recorded signals and provide an initial assessment of the heart's condition. However, final interpretation is typically done by a healthcare professional. Storage and retrieval. The ECG machine can store the recorded ECG data for future reference or comparison. This is especially useful for monitoring changes in a patient's heart activity over time. Printout. Communication. Some ECG machines have the capability to transmit data electronically to other healthcare systems, facilitating remote monitoring and consultation. Overall, the ECG machine plays a crucial role in diagnosing and monitoring various cardiac conditions by providing a visual representation of the heart's electrical activity. The interpretation of the ECG is an essential component of cardiovascular assessment and is often used in conjunction with other diagnostic tools for a comprehensive evaluation of a patient's cardiac health. The electrocardiogram, ECG, is a vital diagnostic tool that provides valuable information about the electrical activity of the heart. While ECG alone does not prevent death, its use is instrumental in early detection, diagnosis, and prevention of potentially life-threatening cardiac conditions. Here are some ways in which ECG contributes to the prevention of death. Early detection of cardiac abnormalities. ECG can detect various cardiac abnormalities, such as arrhythmias, myocardial infarction, heart attack, and conduction disorders. Early detection allows for timely intervention and treatment. Identification of ischemic heart disease. Ischemic heart disease, caused by reduced blood flow to the heart muscle, can be identified through changes in the ECG pattern. Detecting ischemic changes early on helps prevent complications like heart attacks. Assessment of cardiac rhythm. ECG is crucial in assessing the heart's rhythm. Irregularities in rhythm, such as atrial fibrillation, can increase the risk of blood clots and stroke. Treatment and management can be initiated to reduce these risks. Risk stratification. ECG findings, along with other clinical information, help in stratifying patients into different risk categories. This aids healthcare professionals in determining appropriate preventive measures and interventions. Monitoring of high-risk individuals. Individuals with a history of heart disease or those at high risk due to factors like hypertension, diabetes, or family history may undergo regular ECG monitoring. This helps in detecting any changes early and adjusting treatment plans accordingly. Preventive measures based on ECG findings. ECG results guide healthcare professionals in recommending lifestyle changes, medications, or interventions to address specific cardiac issues. This proactive approach can prevent the progression of heart disease and associated complications. Risk prediction in emergency situations. During emergency situations, such as chest pain or sudden cardiac events, an ECG is often performed quickly to assess the situation. Rapid identification of abnormalities allows for prompt treatment, potentially preventing cardiac arrest or other life-threatening events. Monitoring response to treatment. Monitoring response to treatment. ECG is used to monitor the effectiveness of medications and interventions. Adjustments can be made based on ECG findings to optimize treatment and reduce the risk of adverse outcomes. It's important to note that while ECG is a powerful tool in preventive cardiology, it is typically part of a broader approach to cardiovascular health. Prevention of death from cardiac issues involves a combination of lifestyle modifications, risk factor management, regular medical checkups, and timely interventions based on diagnostic findings, including those from the ECG. Individuals at risk of cardiac issues or with a known heart condition should work closely with healthcare professionals to develop a comprehensive prevention and management plan tailored to their specific needs.
We sincerely appreciate you taking the time to watch our content on Groups. Your support means the world to us, and we are thrilled to have you as part of our community. If you enjoyed what you saw, don't forget to hit that subscribe button. Subscribing ensures that you stay updated with our latest videos, updates, and exciting content. By subscribing, you become an integral part of our growing community, and your support inspires us to create more engaging and valuable content for you. Thank you for being a part of the Groups family. We look forward to bringing you more entertaining and informative content in the future. If you have any suggestions or topics you'd like us to cover, feel free to leave a comment below. Once again, thank you for your support, and we can't wait to share more exciting moments with you on Groups.